Is your payroll too high? How would you know? And if it is, what should you be doing about it? Well, that's what I want to talk about in this week's tip. All right, so for this week's tip, we're going to really dive into the subject of payroll. We're going to take a look at, what should your payroll as a percentage of overall revenues be? We're going to look at show you how to determine where you are now in your practice currently, and we're going to take a look at if it's too high, why that might be, as well as what should you be doing about it. So dentistry itself, as far as financial management goes, is a game of percentages. You have different categories of expense, and if you want to run efficiently, or profitably, you can't have these different categories exceed a certain number. So what I'm going to do, and this is where I'm taking these numbers from, I'll put this up on screen. We have two downloads that you can get by clicking the link below in this video. The first one is an overhead sheet where you can actually determine what your overhead actually is in your practice. This is a very complete overhead sheet. We use it with clients so you can take a look at all the expenses that you might even forget. And we made this overhead sheet in response to asking people what their overhead was. They'd say it was 40, and it was really 50. So this is a very complete sheet. And we've got two versions. One's an analog version, one's a digital version. Use the digital version, it's a lot easier. The other handout is something where it says it's overhead percentage by category. We call it overhead guidelines. So I'm going to go down this sheet on screen here, and you'll see we get down to payroll, and the payroll percent as a percentage of revenues should be at 22.5%. Now, there are a few qualifiers with this. Okay, first qualifier is that number does not include the doctor-owner or associate doctors. I'll say it again, does not include the doctor-owner or associate doctors. That 22.5% includes everyone else, your office manager, your hygienists, if you have a lab tech, anybody else working in the practice is in that 22.5% number, except doctor-owner, associates, or even specialists if you have them as associates, all right? Second thing is that 22.5% number does include employer payroll taxes. So you pay, in the United States, you pay FICA, which normally works out to be about 7.65%, Social Security and Medicare. There's an employer percentage of that as well as the employee. That gets included in that 22.5%, so that is included in there. Now, if you're watching from Canada, we do have a lot of clients who practice in Canada. I took a look at what that number should be, and it was difficult to figure it out with the taxes just because there's a little bit of difference between provinces. So here's the number for you if you're a Canadian dentist. Your number is 20.9%, not including the doctor-owner or associates, and not including employer payroll taxes. All right? So that's your basic number. So if you know that that's your basic number, the next thing you got to figure out is, where do you stand now? Well, figuring that out is relatively easy. Essentially what you're going to want to do is you're going to want to take a 4-month average of your collections and a 4-month average of your payroll. I'm a big, big fan of proper sample sizes. I don't want 1 month because, some months are up, some months are down. I want a 4-month average because, in 4 months you can pretty well figure out what's going on. So 4-month average of collections, 4-month average of payroll, including taxes. So let's just say, for our example, we determine that we're collecting an average of $85,000 a month. That's our average, all right? Then we take a look at our payroll, and it's $30,000 a month. Okay, that's our average. So what would we do? We would divide our payroll, we'll put this up on screen, of $30,000 by $85,000. And what number does that give us? It gives us 0.352 or 35.2%. Well, what is our percentage supposed to be? 22.5. We're way out there. We're 13% too high. Now, I will say, if you find yourself in this boat where you're over 22.5%, that is not unusual. As a matter of fact, normally when we see new clients coming in, it's very rare to find somebody who comes in at below 25%. So don't freak out. Don't worry about it. This is very fixable. That's why, for that matter, normally I do these tips behind a podium. Doing this one sitting down, because we're talking about numbers, right, to keep things calm. But keep things calm, not a big deal. There are things you can do about this to fix it. It's very easy. So we have our example, 85,000 collection, 30,000 payroll, which includes taxes. We now have a payroll percentage of 35.2%. Okay, so now, the next thing I'm gonna wanna do, and I do this with every new client that I end up meeting with, so this payroll percentage is almost 13% too high. The next thing I'm gonna do is I'm gonna figure out if your payroll is $30,000 a month, what should you be collecting? And collection is the word, not production, folks, okay? What should you be collecting to justify that $30,000 payroll? In other words, what is $30,000 22.5% of? All right, so simple equation for this. We're going to take $30,000 and divide it by 22.5 and multiply it by 100. I'm sure there's a more fancy way of expressing this from an algebraic perspective, but we're just making this very simple, okay? So $30,000 divided by 22.5 is $1,333. We multiply that by 100, we come up with $133,333. Okay, so now, if we take $133,333 and multiply it by, or want to find out what 22.5% of that is, what is it? It is $30,000. In other words, if I'm going to have a payroll of $30,000, I'm supposed to be collecting $133,333, not $85,000. Do you see the difference? Okay, so that's the next thing I'm going to want to look at after I've looked at where is this person, or where are they, right? I'm then going to want to look at where should they be if they're going to carry this high of a payroll. So that being said, if you found yourself in this boat where you are higher than this 22.5%, and this is what I'm going to do with a newer person to sort of dig in. There's always rare, bizarre cases, but I'm going to go through the 5 most common reasons their payroll as a percentage will be too high. So let's start with the first one. First one would be that this office is carrying way too much managed care, too many PPOs. Maybe they're involved in HMOs or other types of reduced fee plans. You see a lot of folks involved in PPOs. Now here's the problem with a PPO is, let's say you're writing off 30% of your fees, just as a globally. Let's say on average you're writing off 30%. I know in a lot of cases it's a lot more. You know, it's not uncommon to see a crown you would normally charge $1,400 for, you're allowing an $800 fee with the PPO you're participating with. That's more than 30%. I think. Yes, it is. But so it's usually more than 30, but let's just be conservative for a second and say your average write-off is 30% with this PPO. Well, let's go back to that example I used a second ago. If you have this office that's collecting $85,000 and they're writing off 30% of their revenue, that means they're only collecting 70% of what they should be. If you were to add all that stuff back at full fee, that $85,000 in production, what would this office actually be collecting? They'd actually be collecting over $120,000. Now, they wouldn't be in that 22.5% number, but they're pretty close. They're pretty close. Remember, 133 was the 22.5% number. So you see how this just takes a big, chunk, big bite out of your income and your potential to make all of your expenses work. And here's the other issue is, if you're doing that crown for $800, it's not like your lab is charging you less because it's a PPO crown. Your landlord is not writing off 30% of your rent for that time period. Your supplier's not charging you less. Your employees are not charging you less. The power company and the water company is not charging you less. So who's paying for this? You are as the owner doctor. It does not work. And here's the funny thing, and I'll tell you what to do about this here in a second, but I've gone through many cases where someone's has a large amount of PPO infiltration in the practice. And we've taken a look, and in a lot of cases, this office could afford to lose 30 to 35% of the patients that they currently have. If they just started charging full fee, let's say they had 1,000 patients in a plan. They started charging full fee, and they lost 350 of them. They were left with 650. In a lot of cases, their income would not change a penny. But their expenses would, because you have less labor cost, less material costs, less lab costs, etc. And this, especially right now, because again, we're talking about payroll percentage, is even more urgent because, we're in an inflationary environment. And what has happened in this inflationary environment is you had a lot of insurance companies go out and take a win, give it to, tell employers that they took this as a win, that they were able to get you, the doctors, the greedy doctors, to reduce what you were willing to accept. So while inflation was going up, payroll was going parabolic the last, 2-3 years. I mean, you've probably experienced this. While that's all going on, prices are going up, payroll's gone up, expenses have gone up. What have insurance companies done for the most part? They have forced you to accept a lower reimbursement, like real classy, if you were to ask me. So if you're in a position where you can't control your fees, there's a reason your fees are your fees, Everything as a percentage is going to be higher. It's not just payroll. Anything you're spending money on, your rent as a percentage is going to be higher. So you are artificially depressing your income because you were accepting less money. Now, you could also say, let's say, and I've run into a couple folks like this, let's say you run into somebody who hasn't changed their fees in the last 4 years. This is 2022 now. Let's say they haven't changed their fees since 2018. Well, there's been a lot of inflation since 2018. If that's the case, you're going to find that you're not charging enough because expenses have crept up during that time. You're going to run into a bit of a problem, and as a percentage then, payroll and other things for that matter are going to be high. So that's reason number one. You're in too much managed care. My suggestion is you need to get out. We have something called the PPO exit strategy session. It's free. You can talk to one of our practice management specialists. You just click the link below and you fill out the form, and they'll actually go over what's happening in your practice and give you some suggestions to be able to start dropping plans. Sometimes it takes a while to drop them, folks. If you've got 80, 90%, it might take you 2-3 years to get out of them. There's a way to get out of them. We can show you. Just click the link below. So that's reason number one. Reason number two, let's have a look at that. Why would your payroll percentage be too high? It's kind of related to managed care in the sense that managed care suppresses your income. Reason number two is your case acceptance is too low. So let me give you an example of this. So let's say you're presenting a case that's 6 crowns to a patient, and you get to the presentation, the patient seems interested, and then they go, doctor, well, how much is insurance going to pay? So you do the math in your head, and you go, okay, well, insurance is going to cover 50% of at least 2 of them. So you say, well, insurance is going to help you with 2, but it's not going to help you with the other 4. So inevitably, what's the next question you get? Well, can we do 2 this year, 2 next year, and so on, right? Okay, so now there's a couple things happening when you do this. Number one, if you knew how to properly communicate with the patient so they understood why they needed all 6, they would opt for all 6 regardless of coverage. That's the first most important thing, because the patient's health is more important than everything else. But the second thing that happens, let's say we do that conversation and we get to the end and you tell me, yeah, sure, we can do the 2 this year, 2 next year, and 2 the year after. Well, think of it from my perspective for a second. 5 minutes ago, you were telling me I needed 6 crowns. I give you one sentence, can't we do 2 of them this year? You immediately acquiesce without even so much as well, we should really do them now or anything. You just go, sure, fine, no problem. Well, don't be surprised if I wonder, how important are the other 4 crowns then? And then don't be surprised if I go, well, how important were the first 2 that I'm agreeing to do? So it's a bad practice. I'm not saying this is never going to happen, where you're not going to have a situation where someone's only going to do what insurance covers. That is going to happen. But you have to know how to sort of bust through that and get through the patient so that they're doing whatever it is that they need, that they want what they need, regardless of coverage. And that's sales. Again, I don't mean to be too linky in this video. We do have videos on this on our YouTube channel. We also talk about it in our podcast. If you really want to know how to sell in a professional environment, I'd recommend that you come to the MGE Communication and Sales Seminars. I'll put a link below. But that's definitely something. It's not uncommon to have a client come to one of these seminars and see them up by 10, 20, 30,000 the next month. As a matter of fact, the average increase for the average attendee is $288,000 the first year. This is just 3 seminars. Anyway, to find out more, click below. All right, reason number 3 that your payroll as a percentage is going to be high is you're paying the person, not the position. You're paying the person, not the position. So I'm just going to throw some numbers out here, and these may or may not be applicable to your area. This is just for example purposes. But let's say you have a dental assistant, and the low salary for a dental assistant in your area is 15. The median is 21, and the high is 27. 15, 21, 27. You had a dental assistant for a few years, and after a few years, you're paying this dental assistant $38 an hour. But, the high in your area is 27. You're paying 38. The problem is, economically, that's not going to work in your practice. Or let's say you have a receptionist, similar type scenario. You're paying them $5 or $10 above what's considered a high level of salary in your area. Well, in those cases, usually, what would be my idea on this is if somebody wants to get more and more and more, because you're going to be asked for incremental raises, someone wants to bust above what a position is actually worth, because there's a certain point where you're overpaying the person, they're going to have to take on more responsibility. That's my understanding, my reality. That's what makes it work. So I might have a receptionist, and then they have to bump up and take on more. And they're doing more for the practice, therefore I'm going to pay them more. I also would make sure I have a good incentive plan in place so that everybody can earn more as the practice earns more. And then it works for everyone because the revenues are up. The payroll's up only when the revenues are up. All right, so that's point number 3. Point number 4 has to do with the employees themselves, one or more. You may have one or more employees that are just not productive. And that happens. You have somebody who just doesn't do their job. And sometimes it's actually worse than that. You know, generally, most people that you're going to hire, that you're going to run into, are decent people. You're going to have a very small percentage of people that just are not great employees. That happens. And it's a lot smaller of a percentage than you think, okay? But you're going to have, let's say, somebody who's not productive, doesn't perform on their job. You may think, well, they're just sitting around doing nothing. That's not the case. They could actually become counterproductive. That does happen. And then what ends up happening is the rest of your team has to pick up the slack for this person who's not doing their job. Some of the rest of your team may even seem nasty or mean at that point. Like, let's say you have a receptionist and they're not doing their job. They're not answering the phone, they're texting, they're watching TikTok, doing things that they shouldn't be doing during work, and then your financial coordinator is having to jump in to do his or her job. Well, don't be surprised if your financial coordinator ends up kind of pissed off. They may seem a bit out of sorts. They may seem not very nice. Well, yeah, because they're having to pick up all the slack from your receptionist. So instead of doing what they're supposed to do, they're doing some of the receptionist jobs. So it's not just that they're non-productive, they're counterproductive. So if you have people who are counterproductive in the environment, that's a problem. There are ways around this. This is why we teach our clients to manage with statistics and have a proper organizational setup and things of that nature. But that will definitely cost you as far as overall productivity and income. And our last point that will, as a percentage, make your payroll percentage too high is when you have staff that are allocated organizationally. Now, I'm going to explain this one with two extreme examples, and you'll start to get the flavor of what I'm talking about. Now, imagine for a second you have a dental practice with one doctor and one dental assistant and 4 chairs. One doctor, one dental assistant, 4 chairs, no hygienist, nobody else. But at the front, we have an office manager, a financial coordinator, a receptionist, and a scheduler. So I have 4 people up front for one doctor and one dental assistant. That would be kind of ridiculous. I have more people at the front than I need to keep that doctor and dental assistant busy. So my percentage my expense of payroll will go up because I have to carry all these salaries, but I don't need all these personnel. All right, that's scenario number 1. Scenario number 2 will flip on the other side. Let's say I have 4 doctors, 8 hygienists, and 12 dental assistants, and 1.5 people up at the front. That person would probably be stressed out of their mind. They're not going to be able to keep all of those providers busy. In a lot of those cases, those provider salaries are going to be very high. So as a percentage of payroll, payroll will start to get a bit messy because I can't keep all these folks busy. So what would I do in these scenarios? Because, my first thought isn't if I see payroll is too high, just fire people. I wouldn't do that. I would want to make people productive. In a lot of cases, it's very easy. But in this case, let's take the example of a lot of people in the back and 1.5 at the front. I might move some of the people from the back to the front. A couple of the assistants go up front and they help fill the place up. In the case with the assistants in the front or the 4 people up front and the 2 in the back, one of them may have to go, I don't know, or I might move one in the back to work with the doctor as an assistant while I have one of the other staff get productive and to fill up a chair for hygiene. So now I have a busier office, right? So there's different ways of handling this. Letting the person go isn't always the solution, but that can definitely cost you if your employees are misallocated. All right, this was a very long tip, and it was a seated tip because it was a serious tip. I hope this helped. If you'd like to find out more about MGE, you can visit us online at mgeonline.com. You can call us at 800-640-1140. And also, don't forget, the downloads for everything I talked about today are below. Find out where you stand with these numbers. See how you're doing, and if you want any help, reach out to us. We'd be happy to. Have a great week, and we'll see you the next tip.